This presentation covers the medical screening and the options for where this can be provided to newly arrived refugees and other similar immigrant populations in King County. Okay, as we get started, I want to just make a quick note about terminology. Given that the King County area is seeing such an increase in other immigration statuses, not just refugee, but SIV and parolee, I've tried to neutralize some of the terminology by calling this the medical screening instead of the refugee health screening, for example, and trying to refer to new arrivals instead of specific refugee. If I do specifically mention a refugee, I mean it in the broader sense of anyone who's coming through the resettlement system and is eligible for this medical screening, which includes SIVs and parolees. So let's talk a little bit about the medical screening. In King County, this is largely provided by the Downtown Public Health Department, and there's an exception to this that I'll get to in a few slides, but the majority of new arrivals are going to be seen at this clinic. The screening itself is a comprehensive health exam, and it's focused on screening for both infectious and non-communicable conditions. Some of the many services that are provided during this appointment are immunizations, basic treatments like for parasitic infections, for example, and generally identifying illnesses or other health conditions. Overall guidance is provided to public health by the CDC, and this is based on the region and country of origin and the health conditions that might exist based on that. In King County, no primary care system has the capacity to take on medical screening for all new arrivals. And so in order to ensure that all eligible clients receive a comprehensive screening exam, public health provides the health screening in our area. And while the public health department is not a primary care clinic, and they provide a distinct service that's separate from primary care, they work really closely with primary care providers in the area, like the Harborview clinics that are serve as primary care clinics and HealthPoint, to ensure that there's a smooth transition to that long-term care. And for example, part of what public health does is make sure that the medical screening results are available to the new arrivals primary care provider to follow up with. So why is the medical screening important? I think we can look at this from a number of perspectives, and so I'm going to start with the reasons that the US government has provided for why this is important, and then move on to sort of looking at it from the WOLAG perspective and then the client perspective. So the top 4 points on this slide are listed on government websites like the CDC for why this screening is so important, and we'll go through each of those briefly. So the first is to follow up on conditions identified in the overseas medical exam. And if you've seen that exam, you'll know that sometimes those records are incomplete or unclear. And so not only does this exam follow up on anything that needs kind of immediate attention, but also it just serves to double check on all of the conditions that are being screened for, and ensuring that the VOLAG and the future primary care team all have the fullest picture of what's going on medically with that client. Looking at it from more of a community perspective, it's also a chance to identify and treat arrivals that have communicable diseases in order to halt their spread in the United States, which is also important. Another reason is to identify and treat conditions which may impact a client's health or self-sufficiency in the long term. And while the medical screening clinic doesn't treat patients long term, this can serve as kind of a first alert to the VOLAG or the client and the future primary care team about any results or any conditions that may, really adversely impact the family in order to potentially start services sooner if necessary. And then finally, it provides the ability for a clinical team that's familiar with refugee health and refugee screening to serve the arrival and their family. And this is also important when you think about all of the illnesses that occur overseas and aren't as common in the US. It's really important to have a trained team know kind of what to look for and screen for in order for the client and their family to be healthy and really start off their risk settlement on a strong foot. And then looking at this from a VOLAG perspective, so obviously all of the above items are important to a caseworker as they want the clients they're serving to be healthy and be connected to care if necessary. But another reason why this is important is it's a core service requirement for VOLAGs to connect new arrivals to their medical screening appointment. So looking at this question from more of a client perspective, I think there's a couple of distinct ways that the medical screening is important that might not have been seen when we're looking at other perspectives. So the way that the refugee health system in King County is set up is that new arrivals will have their health screening done at Downtown Public Health and then establish primary care at a primary care clinic. This isn't always the case, but in general, this is the way it happens. So this appointment is likely the first contact that the client is having with the healthcare system and the first time that anyone with clinical training is seeing them. And that can be important to a new arrival to know that they've generally been checked out by a clinical provider, especially if they have known illnesses that might be of concern to them. Secondly, while the Refugee Health Clinic doesn't see clients long-term, they are trained in refugee health, as I mentioned previously, and they serve as advocates for the clients that they're seeing to coordinate care and communicate needs back to other teams. And if it's the first time you're interacting with the U.S. healthcare system, you might not know where to go or how to get connected to care. And since this is the first clinical team examining a new arrival, they can inform the VOLAG and the primary care provider, if that provider is known, to make a plan to get things figured out. So a few examples of this might be a new arrival being seen at their medical screening and they're about to run out of medication. The public health team can then contact the VOLAG and or the primary care provider to figure out a way to get more medication for that person before they run out. Or they might be seeing maybe a child who has an acute ear infection or, something that isn't necessarily a long-term diagnosis, but is causing pain and needs to be addressed more quickly. And so they can advocate on the client's behalf to get the client into care quickly. And then finally, looking at it from a client's perspective, the refugee health screening includes immunization evaluations, and this is tied to green card or school immunization requirements. And so it's really a place for refugee families to start some of those immunizations or continue some that might have been started overseas in order to be able to attend school and eventually get their green card if they're not an SIV or another immigrant category that gets the green card right after arrival. So now that we know what the refugee health screening is and why it's important, let's talk a little bit about the options in King County. So for the majority of your clients, likely over 90%, Downtown Public Health Refugee Clinic is going to be the location where they have that screening completed. The only exception to this are clients that are being seen at Harborview. At the International Medicine Clinic, the providers there will automatically do the health screening. They have been trained to do so, and so they have the same guidelines and same training as Downtown Public Health to complete this. If you have a client going to the pediatric clinic at Harborview, it depends on the provider. So I would say in general, if you have an arrival and you know they're going to be seen at Harborview, discuss the refugee screening with the nurses there to make sure that it's going to be covered, because there may be some exceptions to having it done at Harborview. But in general, if your client is being seen at Harborview and you know that prior to arrival, they're going to have the refugee health screening done there. And if they're part of the general population of clients you're seeing, they're just going to go as usual to the Downtown Public Health Refugee Clinic. So to recap the medical screening, it's focused on screening and identification of disease. It's a distinct and separate service from primary care. And for most of your clients, it will be completed at Downtown Public Health, the exception being for those with complex medical needs who are being seen at Harborview's International Medicine Clinic or Harborview Pediatrics Clinic.